We are back at Atlantic Health System, home of Atlantic Sports Health. I am here with Dr. Hsiu, sports medicine radiologist.
Yes.
That you spend a lot of time looking at x-rays and MRIs. And today we're going to talk about a stress reaction. I think most people understand what a stress fracture is, but can you explain that for them anyway, just to make sure they understand a stress fracture, and then let's define a stress reaction.
Right. So basically the stress reaction is sort of the precursor to a stress fracture, where the bone is getting irritated. You have an abnormal amount of stress. Typically it's like recurrent stress on a bone, and you're not giving the bone a chance to properly heal and remodel. And if you keep stressing the bone, it'll progress to a stress reaction, and more seriously, beyond that, eventually you can develop a stress fracture, which is the actual crack in the bone that we typically think of on an x-ray.
Right. So what's interesting, Dr. Hsiu, is obviously stress fractures are seen on an x-ray, but a stress reaction is not seen on an x-ray. So you might have an athlete or a patient that has taken an x-ray and some doctors might say, you look good, there's no issues, but without an MRI, you're not able to see the true picture.
Right, exactly. And and that's why MRI is advantageous. It's much more sensitive compared to an x-ray. By the time you get to an x-ray and you're seeing the pathologic finding on the x-ray, it's kind of like too late, So the advantage of the MRI is, you can see the degree of stress reaction, which is, again, it's the precursor to getting the fracture. So it's good for parents to know whether whether they need to shut down their kid for a while, to give them a chance to heal, before there could be some serious deleterious effects.
So if there's pain, say in the humerus on a thrower, right, say in this upper arm, and they go get them x-rayed, but there's something going on that's causing that pain, and very well it might be a weakening in the bone, in the humerus, known as a stress reaction.
Exactly, and that would only early on be picked up by MRI, and that's the advantage.
Right, and sometimes you might not take that step to get an MRI, maybe because it might not think it's as serious, but when they have pain, that's a signal to stop. Stop doing what you're doing that causes pain, and that could take place not only in the humerus, but in the hip, like you said, the shins. Where else have you seen common stress reactions?
Most commonly is the hips, like the femoral neck area, and even also in the shins, the tibia as well. And it's also important to recognize the patterns of stress reactions, because some patterns, depending on where in the femoral neck or where in the tibia that's involved, some are unstable versus stable stress reactions. So you have to distinguish which pattern of stress reaction that you're seeing. It's just not like, okay, this is stress reaction next. Some stress reactions actually are unstable, meaning that they take longer to heal. So therefore, it's even more important to know exactly where the stress in the bone is involving. And if it's not addressed properly, it can be, the unstable ones, they take longer to heal, and they can definitely progress to fractures.
Fractures, which is
to
really
unstable fractures,
really devastating when you get a stress fracture in the bone. So how long does it typically take to heal? What's the minimum and maximum that you see for stress reactions to heal?
Yeah, and well, it depends on how serious it is on the MRI. So you can tell on MRI, basically how bright the bone is on fluid sensitive sequences. Depending how bright it is.
If it's bright, then there's more stress reaction.
Exactly.
So the bone's weakening more.
Exactly.
There's more weakness in the bone.
Exactly. So you have to correlate it with that level of the intensity of the abnormality on the MRI to determine how long how long you may have to shut down the athlete or the young patient.
Is it anywhere from 2 to 8 weeks?
Yeah. Typically it is in that range. But again, if it's one of those unstable stress reactions, it could take many months.
Oh, it could take months.
It could take 3 to 6 months.
Wow.
So
and you might not even have a fracture, but you might need 3-4 months to heal.
Exactly.
And shut down.
Exactly.
Interesting.
Yeah, and all this has to be relayed with the physicians, the sports medicine doctors, and that's why this place is great too. Because we get to collaborate with the other departments. And the patients get it's a great line of communication.
Excellent. I mean, it's so informative, and to understand stress reactions and to have it all in one building here, to be able to have an MRI and kind of evaluate that MRI and see, what's the risk factor here, because the last thing you want to do is have a stress fracture, right? That's what leads to it. But thank you so much, Dr.
You're
Hsiu.
welcome. Pleasure
Very
being here.
informative. Excellent stuff. Thank you for being on.
Thank you. Yeah, thank you for having me.
Yes.